Ebola fears surge on the ground in Congo over rapid spread of a rare type. Add AP News as your preferred source to see more of our stories on Google. Add AP News on Google. Add AP News as your preferred source to see more of our stories on Google. Share Bunia, Congo AP. Anxious healthcare workers in eastern Congo said Wednesday they are underprotected and undertrained in a rapidly spreading Ebola outbreak of a rare type of the virus in one of the world's most remote and vulnerable places. The region has long been threatened by armed groups that control a major city, where Ebola cases have now been confirmed, complicating health workers' catch-up efforts to trace the outbreak. The World Health Organization, which noted a low risk globally, has said patient zero has not been found. It's truly sad and painful because we've already been through a security crisis, and now Ebola is here too, said Justin Ndasi, a resident of Bunia, where the first known death was announced last week after what experts say was a worrying delay in detecting the virus. Tons of health supplies have been airlifted to Bunia, but residents said masks are harder to find and some disinfectants that previously sold for 2,500 Congolese francs, about $1, now cost 4 times more. Red Cross workers carry the body of a person who died of Ebola into a coffin at a health center in Rwampara, Congo, Wednesday, May 20, 2026. AP photo/Moses Sawasawa Red Cross workers carry the body of a person who died of Ebola into a coffin at a health center in Rwampara, Congo, Wednesday, May 20, 2026. AP photo/Moses Sawasawa at AP News on Google. Add AP News as your preferred source to see more of our stories on Google. Share Facebook, copy link, copied print, email, X, LinkedIn, Blue Sky, Flipboard, Pinterest, Reddit. Read more. A mother watches her son bleeding and vomiting at a treatment center in Rwampara. Healthcare workers in protective gear silently handled the bodies of suspected Ebola victims. Families, which traditionally washed deceased loved ones, cried and watched helplessly as workers disinfected them and placed them into coffins for secure burial sites. The disease struck suddenly, they said, describing a rapid deterioration after symptoms were mistaken for illnesses, such as malaria. He told me his heart was hurting, said Bopwine Swans, who lost her son. Then he started crying because of the pain. Then he started bleeding and vomiting a lot. The Ebola virus is highly contagious and spreads in the human population through contact with bodily fluids such as vomit, blood, or semen. Symptoms include fever, vomiting, diarrhea, muscle pain, and at times internal and external bleeding. Read more. WHO chief says the scale of the epidemic is much larger. WHO has declared the outbreak a public health emergency of international concern, worried over its scale and speed. The WHO chief in Congo says it could last at least 2 months. The rare type of Ebola, known as the Bundibugyo virus, spread undetected for weeks following the first known death, while authorities tested for another, more common Ebola virus and came up negative. Investigations continued into where and when the outbreak started, but given the scale, we are thinking that it has started probably a couple of months ago, said Anaïs Legend with WHO Emergencies Program. So far, 51 cases have been confirmed in Congo's northern provinces of Ituri and North Kivu, and 2 cases in Uganda, WHO Director General Tedros Adhanom Ghebreyesus said Wednesday. There are 139 suspected deaths and almost 600 suspected cases. But the scale of the epidemic is much larger, he said. The London-based MRC Centre for Global Infectious Disease Analysis estimated that cases have been substantially undercounted and that the actual number could already exceed 1,000. The true magnitude remains uncertain, it said. This is Congo's 17th Ebola outbreak, and the WHO has said the country's health ministry has experienced staff and capacity to respond. Most outbreaks, however, were of the more common Ebola type. Relatives look on as people who died of Ebola are taken from a health center in Rwampara, Congo, Wednesday, May 20, 2026. AP photo/Moses Sawasawa relatives look on as people who died of Ebola are taken from a health center in Rwampara, Congo, Wednesday, May 20, 2026. AP photo/Moses Sawasawa at AP News on Google. Add AP News as your preferred source to see more of our stories on Google. Share Facebook copy link copied print email X LinkedIn Blue Sky Flipboard Pinterest Reddit read more any potential vaccine is months away Dr. Vasi Morthy, a special advisor at WHO said a vaccine to address Bundibugyo would not be available for at least 6 to 9 months. Eastern Congo already faced immense pressure from conflict, displacement and a collapsing health system, said Dr. Levin Bangarli, senior health coordinator for the International Rescue Committee in Congo, adding that years of underfunding have weakened the response. The outbreak highlights the effects of the Trump administration's deep cuts in foreign aid. U.S. Secretary of State Marco Rubio has said the administration set a priority on funding 50 emergency clinics in affected areas. The U.S. pledged to contribute $23 million. Anxiety grows with little protection in affected places in Bunia. Schools and churches remain open while some residents wear masks. Elsewhere in Ituri province, suspected Ebola patients share a ward with others injured or ill at Bamboo General Hospital. A Doctors Without Borders team identified suspected cases over the weekend at Bunia's Salarm Hospital, but found no available isolation ward in the area, said Trish Newport, an emergency program manager. Every health facility they called said, "We're full of suspect cases. We don't have any space." This gives you a vision of how crazy it is right now, she said on social media. Family members of people who died of Ebola stand next to coffins at a health center in Rwampara, Congo, Wednesday, May 20, 2026. AP photo/Moses Sawasawa family members of people who died of Ebola stand next to coffins at a health center in Rwampara, Congo, Wednesday, May 20, 2026. AP photo/Moses Sawasawa at AP News on Google. Add AP News as your preferred source to see more of our stories on Google. Share Facebook copy link copied print email X LinkedIn Blue Sky Flipboard Pinterest Reddit read more in Mongbuarlu, where the body of the first known death was taken. The nearby border with Uganda remains open and gold mining continues, said Sheruben Kuku Endalarwa, a civil society leader. There is no panic. People continue with their normal lives, but they're also starting to spread the word, said Endalarwa, and noted a lack of public hand-washing stations. There were around 30 Ebola patients at Mongbuarlu General Hospital, where a student from the local Medical Technology Institute died on Wednesday, Dr. Didier Pace said. The patients are scattered here and there, said Dr. Richard Lokudu, the hospital's medical director. We hope for the proper triage and isolation facilities to be installed today, and if that doesn't happen, we will be completely overwhelmed. They are understaffed and not trained to handle suspected cases, Lokudu said, and added that if confirmed cases surge, we have no protection. In the Ebola-affected city of Goma, where Rwanda-backed M23 rebels are in control, the situation is complicated, said Dr. And Anshar, who representative in Congo. An American with Ebola is in isolation. In Germany, a U.S. national who tested positive in Congo arrived in Berlin on Wednesday and was in a special isolation ward, where a comprehensive examination was underway, German Health Ministry spokesperson Martin Elsesser said. Elsesser declined to comment on the condition of the patient, who has not been identified by German or U.S. authorities. The ministry later said, without elaborating, that it would take in the patient's wife and 3 children at the request of U.S. authorities. A top health official in the Czech Republic said, they are receiving an American doctor who is treating Ebola patients in Uganda and who is without symptoms. It was not clear whether any were infected. Dr. Satish Pillai, incident manager for Centers for Disease Control and Prevention's Ebola response, told reporters Wednesday that the Americans were being transported in coordination with the U.S. State Department and other agencies. One patient, who is in stable condition, is now being treated in Germany, Pillai said. Asked whether the White House played a role in the decision to move the Americans to Europe, Pillai said the decision